Artificial intelligence is rapidly transforming healthcare, offering new tools to assist doctors in diagnosing and treating patients. But what happens when these AI systems make mistakes? Recent research reveals that even experienced physicians can be influenced by AI errors, sometimes following incorrect guidance despite clear evidence to the contrary. This video explores a fascinating study that sheds light on the complex relationship between doctors and AI and why critical thinking remains essential in medicine. Recent study published in PLOS Digital Health set out to investigate whether physicians could override AI-generated errors when provided with relevant patient outcome information. The researchers designed two experiments involving over 220 self-reported physicians, each tasked with making treatment decisions for fictitious patients classified by an AI system. The goal was to see if doctors would trust their own judgment or defer to the AI, especially when the AI's recommendations were clearly contradicted by patient outcomes. Both experiments, physicians interacted with an AI system that misclassified 60 fictitious patients into groups labeled as more or less sensitive to a new drug. Despite the AI's classifications, patient outcomes did not align with these groupings. In the first experiment, the drug was moderately effective for all, while in the second, it was completely ineffective. Doctors received immediate feedback on each patient's recovery, giving them the chance to spot the AI's error. Interestingly, the study found that physicians generally trusted the AI's classifications, even when patient outcomes suggested otherwise. In the first experiment, most doctors rated the AI as fairly reliable and continued to follow its recommendations. This trust persisted even when the evidence showed that the AI's groupings were incorrect, highlighting the strong influence AI can have on clinical decision-making. Despite receiving clear patient-level feedback, many physicians struggled to update their judgments based on new evidence. They often continued to administer the drug to patients classified as more sensitive by the AI, even when recovery rates were similar across all groups. This suggests that once an AI system provides a classification, it can be challenging for doctors to override it, even with contradictory information. The first experiment, the drug was moderately effective for both A-classified groups. However, doctors were much more likely to administer the drug to patients labeled as highly sensitive by the AI. Specifically, nearly 90% of these patients received the drug, compared to just over half of those classified as less sensitive. This pattern persisted even though recovery rates were similar, indicating that the AI's influence was strong. Second experiment took things further by using a drug that was completely ineffective. Surprisingly, many doctors still believed the drug was effective, especially for patients the AI classified as more sensitive. Over 3/4 of these patients received the drug, compared to about a third in the other group. This overestimation of effectiveness, despite clear evidence, raises concerns about patient safety if similar patterns occur in real-world practice. Study also measured participants' attitudes toward AI. Most physicians viewed AI positively and rated it as reliable. Interestingly, concerns about AI did not necessarily make doctors less likely to trust its recommendations. This suggests that positive attitudes toward technology can reinforce reliance on AI, even when it's not performing accurately. Researchers suggest that cognitive biases like automation bias and confirmation bias may play a role in why doctors stick with AI recommendations. Automation bias occurs when people over-rely on automated systems, while confirmation bias leads them to favor information that supports their initial beliefs. These biases can make it harder for physicians to recognize and correct AI errors, especially in uncertain situations. It's important to note that the study had several limitations. The experiments used fictitious diseases and treatments, and the participants' professional status was self-reported. The scenarios were highly controlled and may not fully reflect real-world clinical environments. Additionally, the study did not compare AI recommendations with those from human experts or traditional clinical systems. Despite these limitations, the findings highlight the need for caution when integrating AI into clinical practice. Doctors should use AI as a tool to support, not replace, their own clinical reasoning. Critical evaluation of AI-generated recommendations is essential, especially when patient outcomes do not align with the system's predictions. This approach can help ensure patient safety and effective care. AI systems are powerful, but they are not infallible. Human judgment, experience, and critical thinking remain vital in medicine. Doctors must balance the insights provided by AI with their own expertise, especially when faced with uncertain or contradictory information. This balance is crucial for making the best decisions for patient care. Study's authors recommend further research to better understand how cognitive biases and uncertainty influence doctors' reliance on AI. Future studies should explore real-world clinical settings, compare AI with human experts, and investigate strategies to help physicians recognize and correct AI errors. This ongoing research will be essential as AI becomes more integrated into healthcare. As AI continues to evolve, healthcare professionals must adopt these technologies cautiously and judiciously. AI should be viewed as an adjunct to, not a replacement for, clinical decision-making. By maintaining a healthy skepticism and prioritizing patient outcomes, doctors can harness the benefits of AI while minimizing risks. In summary, this study reveals that even skilled physicians can be swayed by AI errors, sometimes at the expense of patient outcomes. The findings underscore the importance of critical thinking, ongoing education, and a balanced approach to technology in medicine. As AI becomes more prevalent, the partnership between human expertise and artificial intelligence will shape the future of healthcare.